There are now almost 260 million people, 260 million people who came from rural areas to work in urban areas. Supposedly they contribute premium, but they don't enjoy the healthcare benefits in the place where they work and live in urban areas. So this is some challenges facing China. And about this redistribution of wealth, I think this is vital because China, as we have heard over the few years, that a lot of rich people are running out of China because they think China is getting dangerous for them. And why? When this happening? Because it's such a big disparity, this feeling of not fair treatment by the country. So I think we indeed can learn a lot, but I think for a country like China, who are very interested in, although there are big problems about a small island, but still, I think there are ways to find out how China can really benefit from this politically sensitive area. Because I think, as you mentioned, next 10 years, China has now entered into a different era. There's a lot of places people are willing to pay to improve the healthcare quality and as you mentioned there, but we are short of the so-called high-level design. Despite in the past 4 years we have done a lot about healthcare reform. So I really think that in the future, probably when things are calming down, we would like to have experts like you to discuss with political leaders in China on learning how to help Chinese governments maintain a stable political future for the party. So this is a great lesson for us, and I think in the future there's a lot of unanswered questions we need to be worked. And based on that, I think the Lancet here, I think we will like to maybe have some further discussion in China. Maybe Apac next year could be one of the topics, while China is aiming to double the income and redistribute the wealth, and how we can learn from Japan. Because, of course, Japan is one of the APEC member countries. So I think you know China pretty well. So any short comments about what China can consider?
Thank you very much. Your wonderful and honest comments. As I mentioned, the important thing is that how to set up the national target of the policy package, including universal health coverage. In Japan, it was produced to be healthy and well-educated middle classes. Therefore, the tax system and the wage system, both public and private, and even universal health coverage, all the policies mutually related to each other and create a synergy effects to formulate the wider population of healthy and well-educated middle class. That's a very important. How we can create the efficient national policy package and share the same purpose. So we could successfully do that under the name of income doubling plan. And even though we are a capitalistic country, we could successfully consolidate our consensus among our own people. That was very lucky. If the people has not the basis of consensus on which the policymaker can realize it, we could not do that. So in China, it's a really large country, and so many, the minority populations, and located in different areas. So I'm very lucky. I'm a Japanese politician. But I know that it's a real difficult things you have to overcome. But your new Prime Minister, Li Keqiang, is a person, when he was a Vice Minister, to create those comprehensive packages, including universal health coverage. So I'm expecting expecting that he is taking a very important initiative to create those most efficient policy package for your people within the foreseeable future.
Okay, thank you very much. Yes, please.
Sir, your excellent deliberation, I enjoyed very much. But if you kindly help me to get one point clarified, is I understand the way you explain income doubling plan. And you also talked about equitable redistribution of income. So in that scenario, sir, I could not understand how the gap between rich and poor is increasing.
I see. You know, honestly speaking, when the Japan per capita income was 4,300, actually there are no large population for wealthy people, right? Therefore, the reform of tax system, which introduced more than 75% of the progressive tax of income applied to those of the wealthy people, they did not have the function to redistribute actually those financial resources for the relatively poor population. That's one of the reasons why the 70% of universal health coverage could have the function to distribute those income. So I'm not sure that I can catch your question, but what I'm talking is that how you can clarify your own country's conditions, the demographic and social and economic, and carefully design the redistribution system under the public and private collaboration. The collaboration of public and private did a wonderful job in our own country based on those kind of tacit agreements among us. That's a very beneficial social partner we could have when we realize those are the policy of package. But actually, when the government applied 75% of the progressive tax into the income tax system, my father was a very wealthy medical doctor. He got very hungry. They also accepted. The important thing is not only those the government political initiatives, but the important thing is that how the private sectors can realize to redistribute those financial resources. Just 1 month ago, I officially asked our Prime Minister Abe at the session of the budget in the Parliament, and I asked him this question, and he quite smoothly reacted to talk about his grandfather's income doubling plan, and he emphasized the importance how the government can redistribute those outcomes of economic growth. And this is one of the reasons why Prime Minister himself asked the head of the big company to raise the wages in this year. That was originally the role of the leader of the labor union. But Prime Minister belongs to everything historically fast to ask the big company to increase their company's persons' wages. This is a kind of a sensitivity, fortunately, we Japanese have. I'm not sure this is the direct response to your question, but this is my own way.
Okay, this is the final question.
Yeah, thank you very much. I'm from Thailand, from the Prima Association. I'm really happy to see that Thailand will be an aging country in the level, in the ranking number 4, together with China. And surely I will be there too. My question to you is that the word of equalized access, are we talking about the one who have a higher level of access to healthcare have to bring down, or we increase those who in a lower access, I mean lower standard or lower level of healthcare provider up to the top? What is mean by equalized access in this kind of policy?
As I mentioned, in 1958, our system for the fee schedule was unified under the fee schedule of this case, employment-based insurance. As a result of this, the unification of the fee schedule, everybody who belongs to which insurance plan could receive the similar healthcare services. This is very important. On the other hand, actually we had the suitable hospitals and clinics at that time. And also we could have pharmaceutical companies which could produce those medical drugs in addition to those which were imported. Therefore, the health system itself, which is consist of the health information, health data, and healthcare delivery, and the governance, and medical products, and so on, which was defined in the definition for health systems. Unfortunately, those each the building blocks of the health system could be specified in 1961. That means we could achieve universal health coverage in 1961. So 1961 is not only to achieve universal health insurance, but to achieve universal health coverage. That is a very important point. So create the financial scheme under the universal health insurance does not mean always universal health coverage. So the health systems approach, which also should have very comprehensive approach, can be simultaneously realized under the government initiatives. Therefore, there are so many necessity to take preparation for universal health coverage. So honestly, I mentioned that we took 40 years to achieve universal health coverage. So, but I know that already Thai friends, that those are the system of universal health insurance. But there are several inequalities, especially in the regions in your country. So the important thing is that how you can create equal healthcare delivery service capacity under your universal health insurance system, and also carefully designed for universal insurance system, which sometimes is facing very serious budget deficit under the aging which already you have.
Okay, thank you very much for your active discussion, and we'd like to close this session. And thank you again, Professor Takemi.